lights, camera, and action. I'm Daniel. This is my basic physical assessment video. Thank you for watching. First thing we're going to do is have good lighting, give some privacy here. I'm going to introduce myself to my patient, Jolene. I'm Daniel. I'm going to be a DNP student today. I'm going to be doing a basic physical assessment and explain the procedure. Tell her to make sure you tell me if anything hurts. And I'm also going to observe her for signs of discomfort throughout the procedure. I'm going to wash my hands. She's going to have her vital signs, height, weight, and BMI done before coming in. We'll review those. Before we even get started, we're going to observe her general appearance, her health status, the fact that she just coughed, her stature, her posture, the color, condition of her skin, her hygiene, any odors, her dress, is it appropriate for the weather, does she look well put together, nutritional status, and all of those things in Jolene look fantastic, despite the fact she comes from Minnesota. We're going to skip now to our physical assessment. First thing is hair, skin, and nails. You're going to inspect her skin, make sure her skin color is appropriate, as she is pink. The temperature, she appears to be warm. I tested with the back of my hand. Skin looks to have good integrity at the moment. It's dry. You can test her skin turgor here, and sure, she has good skin turgor. And her hair looks evenly distributed and appropriate for what it should be. Her nails we can look at. Skip to cardio for a moment and do some capillary refill, but also look at the shape, the condition of her nails, if there's any clubbing, which there is not. And again, just hair distribution and texture. Moving on to head and face, we're going to inspect and palpate her head and her scalp. While we're doing that, we're going to be looking for any lesions, injuries, bruising, this kind of thing, lice, all those things. So we're going to palpate the scalp here. No crepitus, everything looks good. I'm going to palpate the mastoid now. We're skipping ahead once again, but we'll come back to that later. We're going to take a look at her face. Her face is symmetrical. We're going to have her move her face around to test cranial nerve 7. You can raise your eyebrows for me. Thank you. Squint real hard with your eyes. Show me your teeth. Big smile. Excellent. You can stick your tongue out for me as well. And you can shrug your shoulders. And we'll talk about all those cranial nerves later. We're also going to palpate the TMJ while we're here on either side, and just have her open and close her mouth a couple times. And that is cranial nerve number 5. Thank you very much. Next, we're going to move on to the eyes. For the eyes, we're going to inspect the external eyes, the lids, her sclera, which her sclera are white, her conjunctiva, which on both sides are pink and look fine, no erythema or anything like that. Yep. Her iris, her pupils, which we're going to look at in more detail here in a moment, and also her corneas. We're going to do her extraocular movements and test accommodation, which is 3, 4, and 6. So just follow my finger real quick. Oh, I should use my light. I'm going to use my light. Follow my light real quick with your eyes, not your head. And this way. Do all 6 fields. Test the convergence, which did work, and then have her go ahead and look at this, and then look at that back wall for me. And the accommodation is intact. I'm going to go ahead and do direct and consensual pupillary response at the moment. And they both are briskly reactive, round, equal, no issues with the pupils. We're going to move on to ears. Let me switch here while I'm doing this. Her ears appear to be symmetrical. The pinnas look like they're intact. They're not reddened or anything like that. We're going to look in her canals and examine her external ear canal and her tympanic membranes at the same time. For an adult, you pull up and back. I should put a little thing on here first. We'll just pretend like y'all didn't see that. And that one looks great. No issues there. Same thing there. The next thing we're going to do is test hearing. I think maybe I should get my own checked. The first thing we're going to do is the Weber test. we're going to go ahead and set this off. Place this on the top of her head. She should hear equally on both sides, do you?
Mm-hmm.
Fantastic. The next is the Ryan test, which we're going to do this again and put that on the mastoid, which we already palpated.
Mm-hmm.
And you should hear that. Tell me when you stop hearing it.
Yep.
And then here, this should be twice as long as that. You still hear it?
Yep.
Tell me when you stop. Fantastic. We will repeat that on the other side. And again, we've palpated the mastoid already, so we're going to move on. For nose, we're going to inspect the nose, the patency, which we can just have her plug one side and breathe out on both sides to make sure we don't get blown any boogers on her. Inspect the nasal mucosa and the septum. Let's look up there real quick with a light. Her nose looks fantastic. You're going to be all right? All right. We're going to palpate her sinuses. Palpate. This is terrible. The frontal, the ethmoid, and for real, just real quick. Did you say you could edit that out? Okay, we're good. Give me a second. Frontal ethmoid and maxillary sinuses. Thank you. Moving on. For the mouth, we're going to inspect the oral pharynx. We're going to have her do tongue movement as well. Can you open your mouth and say ah for me?
Ah.
Thank you very much. Can you stick out your tongue, moving from side to side? Excellent work. And then we would also at this point do the gag reflex, which I am not going to do on my friend here.
I appreciate
These are
that.
cranial nerves 12, 10, and 11. Moving on to the neck, I'm going to go ahead and lose this. For the neck, we're going to make sure that it's symmetrical. There's no lumps, bumps, pulsations. At this point, I'd also auscultate for any carotid bruits, which we'll do real quick. And I don't hear anything, so this must be good. I'm going to jump over to neuro real quick. For neuro, we're going to have her do a quick finger to nose test. So take your finger, please, put on your nose, and then touch my finger. Do this a few times. No ataxia. She looks like she's doing fine with that. Rapid alternating movements. Put your hands down like this. Flip them over. And then do that a few times real fast. That works fine as well. Do her heel to shin, which literally is take your heel and rub it down your shin on both sides. That was easy as well. Have you stand up and do a Romberg test real quick, which is just put your feet together, put your hands down by your sides, close your eyes, and don't fall over. That was perfect. We're also going to test your gait real quick if you would just walk there. Perfect. You can heel to toe, walk back. At this point, we'd also have her walk on her heels and her toes to make sure that all of that gait is intact, and it is. We won't do that. And before you sit down, do a shallow knee bend, which she'll do now. Excellent, excellent work. Go ahead and have a seat. Thank you for doing that. We're going to test sensation on her face, but also on at least 3 or 4 of her extremities. Not more than 4. We'll do sharp and dull using this. So you can tell me if it feels sharp or dull.
Sharp.
Fantastic. Then we have the dull here. Sharp, sharp. And what about that?
Dull.
That?
Dull.
Fantastic. And again, we will repeat that on the extremities. For vibration, I'm going to do vibration after I do the reflexes, since I'm already here. We do the brachioradialis reflex. If I can get it. It worked. Thank you. Do the bicep. The tricep reflex there. Oh, that one did work. The patellar. And then last but not least, the Achilles. Not my favorite one. Oh, there it goes. Perfect. We got the deep tendon reflexes down. We're also going to, before we put this thing away, do the Babinski reflex, which again, I'm not going to examine her feet, but I would in real life, and just graze the sharp object from her heel to her toes, and they should not
Curl.
fan out. Yes, curl. Thank you very much. Last but not least, we're going to do the vibration on both big toes, which you would hold the toe and put this on the side, and then the same thing with her hands. At the moment, just for the sake of time, we'll just go ahead and skip that. Also, we're going to do the eye chart. We would use a Snellen eye chart, similar to what that looks like. Place her at 20 feet. Do both eyes together, one eye or the other. with or without corrective lenses. And again, for time's sake, we'll just say that we did that. Moving on to chest and lungs, we're going to inspect the posterior thorax and her AP diameter. Again, she would be gowned for this, and we would uncover her if this was a real patient. Make sure they're symmetrical. Note the shape of her chest, that she's not barrel-chested or anything like that. We would auscultate the anterior and posterior of the chest. We'll speed this up for time's sake. Please don't actually breathe that fast. I don't want anybody passing out. While I'm here, I'm going to skip to cardio real quick, and I'm also going to do her heart sounds. We're going to do the aortic, pulmonic, the Erb's point, the tricuspid and bicuspid, both with the diaphragm and the bell. I would also do point of maximal impulse, but we don't know each other like that, so we'll just pretend like I did that as well. For respiratory excursion, I'm going to skip to the back here. I would have her take a deep breath and hold it, percuss and find, oh yeah, thank you. Percuss and find the bottom base of her lungs. Go ahead and breathe out for me. Take a couple normal breaths so you don't pass out. And then exhale and hold it for me if you would. And find the base of the lung on both the inhalation and the exhalation and measure the difference. Next, we're going to do diaphragmatic excursion. So, put my thumbs together here and go ahead and take a deep breath. And then measure the difference there. Fantastic. Thank you so much. Yes, and before I'm done, also the tactile firmness, and have you say 99 a few times for me.
99.
Again?
99.
99.
99.
Excellent. Thank you very much. And we do the same thing on the front, which again, we're going to skip. The next is abdomen. We're going to have you lay down for the abdominal exam, if you would, which is quite appropriate in this birthing bed.
Great.
Before we do anything, we would inspect the abdomen for any scars, pulsations, color changes, things like this, hernias, which we've talked about all day long. We'll auscultate all 4 quadrants. Not just for bowel sounds, but we'd be auscultating for bruits as well, over the aorta, the renal arteries, and also the femorals. I'm also going to do some light palpation in all 4 quadrants. Making sure I watch her face while I do that to make sure that she doesn't appear to be in pain. Are you good?
Fine.
Sit up, man. Again, we got to get that cough treated. So musculoskeletal, we're going to inspect, palpate, and do range of motion of all her major joints, which is going to start going back to a little bit of neuro, but we're combining things here. For cranial nerve 11 is doing the neck straight. So we'll just have you go ahead and turn your head against resistance here. Thank you very much. The other way. I wasn't expecting that way first, but that's fine. She already shrugged her shoulders, so we're good for that. The next thing we will do, obviously, is elbows, wrists, hands, and fingers. And again, you would do full range of motion with all these. Also, going down with the hips, knees, ankles, feet, toes. We'd also do spinal alignment and range of motion as well. For spinal alignment, much like you would examine for scoliosis, we would just have her bend over, but once again, we're just going to skip that for the evening. That's my physical assessment. I hope you all enjoyed it. Thank you for watching.